child isn't feeling well, the decision of whether to keep them home from school can be agonizing.
Yes,
not always clear.
It's
for
a
mom
tough
and dad.
one. Yeah, a new poll from University of Michigan Health CS Mott Children's Hospital is shedding some light on what most parents consider when making that decision. Dr. Frank McGeorge is here with surprising consideration that's becoming more common.
Absolutely, Kim and Devin. So, this is, of course, there are some obvious reasons to keep your child home. If they have a fever, if they're throwing up, that's a pretty easy decision. But what if they say they just don't feel well, but they don't look too bad? Or how about if they're feeling stressed out or anxious and don't have any physical complaints? Well, the survey shows those have actually become important considerations.
It's important for kids to attend school regularly. It helps them succeed academically, socially, is good for graduation rates. And there are times where parents have to make a decision about whether their kid is too sick to go to school, and it's not always obvious.
But Sarah Clark, co-director of CS Mott Children's Hospital's poll on children's health, says 1 in 5 parents consider whether their child may need a mental health day from school.
I think that's really an important recognition on the part of parents that mental health has become such a big issue for youth in this country. It's a little tricky for parents to make this work, though, because they want to recognize situations where that mental health break might be good for their child, but not set up a situation where it happens too often or the kid is trying to get out of school too easily that way.
More than 90% of parents reported that their child's school has an attendance policy, but 1/4 of parents say the policy makes it difficult for children with a medical condition. Clark says when considering a school absence, it's important to talk to and work with your child.
If the timing is right, that can be setting up a situation where you try having the kid get dressed, eat breakfast, see how it goes, and sort of watch their behavior.
Now, the poll also found more than half of parents also considered whether they felt like their child would make it through the day based on how they felt. They also considered whether they might pose a contagion risk to staff and other students. An interesting offshoot, I think, probably from COVID.
Yeah, exactly. So you mentioned attendance policies in the piece. Most schools have the attendance policy. What do you do if you're a parent and your child is exceeding or getting close to exceeding those days?
Well, so that's probably a time when you want to involve your child's health care providers because, frankly, they can provide some better advice on when it is really absolutely necessary to keep your kids home. But they can also help inform the school officials if your kids may need some special accommodations. And in some cases, that may actually be really important.
It's tricky for a lot of parents. If a kid takes sick day, it means they have to take a sick day.
That's
and it's,
exactly
it gets
right.
very
There is that effect,
complicated with
too.
health care. I mean, child care. Yeah. All right, Doc.
Thanks, Doc.